years, but I started as a CNA when I was 15 years old, so I've been doing this a very long time. I love it. So if anybody wants to come join the ranks of RN at some point, please do. It's a fabulous field. Today I'm going to talk about sterile technique, which from what I understand you guys have all done, so this is more of a refresher for you. What I find the most difficult is putting the gloves on and not touching my fingers, because that's very hard to do, especially when you pull them on and they get stuck. And the other thing is that dropping stuff on the field and not touching it, because it's habit to reach over to do things. You know, oh, I'm going to do something on the bed and let me just get, well, you're not clean here, so you can't do that. Does anybody know why we wear light colors like the blues and the greens and the ORs?
No.
Is it in case you get something on your scrubs, you can see it?
No, that's a good answer though. No, it's to help with the glare. It's to decrease eye strain, because you're in the operating room sometimes for so long that the brighter colors hurt your eyes. It has nothing to do with infection. Isn't that bizarre? It's like, are you kidding, really? I didn't know that. So I'm going to just start really quickly with a sterile field, because this is, this is one of the things that you're going to find yourself doing a lot of. And it's not easy. It sounds easy, but it's not. Opening from the corners and not touching anything. So you're going to open from opposite corners, which as you can see is not the easiest thing to do, and not touching the top. Now my field is sterile, so anything in the middle I shouldn't touch. Anything on the side, sometimes you need to grab stuff. If you can sometimes grab from underneath and grab, but really you shouldn't touch anything without your sterile gloves on the top. Now for the fun part. Opening the package. Now once you open, it's sterile in the middle. Everything from the inside is sterile. And and they're really nice, left, right. They tell you what hand it goes on, because, believe it or not, I've put them on the wrong hands, and once you put them on, you're done. So grabbing from the folds, you pull it open, and now you have your sterile. And the only thing you can touch is the folded cuff. Anything below the cuff is considered sterile, and once you touch it, you have to throw it away. You can't use it again. So in order to put them on properly, you grab the cuff, put your hand in, and pull your hands in. So now I'm sterile. This hand is now sterile. The only thing that's not sterile is here. Okay? Now does anybody know how do I get the other glove?
Under the cuff.
Right, you got it. Which is a lot easier said than done some days, especially if you get the wrong size gloves. And then the same thing, just slide them in and on. Now see, my finger didn't go all the way in? Now I'm sterile, I can touch. Now I'm sterile. So I can touch anything here. Now my bigger problem, I'm sterile. How do I get my stuff over there?
Wait, force it.
Ask somebody for help, because my hands are completely sterile. There's nothing I can do about it. So let's say I'm not sterile anymore, say I'm just helping. How do I get what's in this package onto this field?
Drop it.
Right. What if this was liquid? How would I get the liquid from this container into, say, a bowl from here? Hmm?
Don't you put it in the corner of the middle?
You can, right. And you would pour it slowly. But one of the most frequently missed things is that when you crack open a bottle, if it's already been opened, you have to pour a little off first, and then you can pour into your sterile field. But you're right, into the corner, avoid splashing, into another sterile container. Now everything is sterile. And then, like you said before, you just drop it in. Now that's all sterile. So if I wanted to do, say, a wound, and I'm changing a wound, a dressing, and I have my patient here and I'm changing my wound, how do I clean my wound and maintain my sterile field?
Yes, somebody else is there.
You can get another set of helpers, or you can designate a hand as dirty. So if I'm right-handed, I'm gonna keep this one sterile because this is the one I'm gonna be picking stuff up with. This is the one I'm gonna use to touch my patient that is now no longer sterile.
You can't, do that before, like clean the patient?
You can, but for some things that require like packing and stuff like that, you have to physically touch the patient, whether it's to get a better grip or to move skin or what have you. And sometimes you have to designate one hand as dirty, which means if I decide I want my left hand to be dirty, I can no longer use this hand to touch anything in this field. What do I have to do if I touch anything in my field?
Start
Start all over, yeah, and that's not fun, especially when you're really busy. Now, if I have a gown and gloves and a mask and my hat on, what is considered non-sterile on my body? Waist down, anything on my back. Suppose I'm walking and I accidentally do this. Yeah, I just contaminated. So I gotta start all over again. Does anybody have any questions for me?